Dr. O'Driscoll's goal in designing the new variable angle locking technology was to safely and effectively incorporate the concepts of locking screws, while remaining true to the principles and objectives he has used to successfully treat distal humerus fractures over the last 16 years. A number of new items have been added to the variable angle locking elbow plate system, including a new drill guide clamp. This unique aiming device is designed to facilitate drilling and placement of the distal screws. To use, place the 2 mm cannula through the clamp and into the selected plate hole. The tip of the clamp is placed at the desired ending point, showing the trajectory of the screw. The clamp may be angled up to 20 degrees in any direction, providing flexibility when capturing fracture fragments. Note that locking screws utilizing tap lock technology must be inserted within this 20-degree range. If the drill guide clamp is not used, a tap screw angle guide is provided in the system to estimate the 20-degree angle. Non-locking screws must be used if the desired angle is greater than 20 degrees. The articular fragments, which tend to be rotated toward each other in the axial plane, are reduced anatomically and provisionally held with 0.045-inch smooth guide wires. It is essential that the guide wires be placed close to the subchondral level to avoid interference with later screw placement and away from where the plates will be placed on the lateral and medial columns. 1 or 2 strategically placed guide wires can then be used to provisionally hold the distal fragments in alignment with the humeral shaft. Tighten the cannula against the plate hole prior to drilling. Drill using a 2 mm guide wire included in the system. Leave this guide wire in place, as it reserves a location for a screw in a later step. A non-locking 3.5 mm bicortical screw is inserted into a slotted hole, proximal to the fracture site on the medial and lateral side of the humeral shaft. Non-locking screws are inserted in the most distal hole of each plate. Most often, 3.5 mm screws are selected. In hard bone, it may be necessary to tap the bone prior to screw insertion. To compress the lateral column, secure the large bone clamp to a screw head slightly loosened in the shaft on the medial side. The opposing end of the clamp should be placed behind the distal wires. With a slightly loosened screw in the medial plate, the bone clamp is squeezed to compress the lateral column. At this time, the medial column may slightly distract, but will be addressed in the next step. Insert and fully tighten a screw in the lateral plate, proximal to the fracture, in dynamic compression mode. Remove the large bone clamp and compress the medial column in the same manner. After compressing both columns, firmly tighten all 4 shaft screws. At this point, we are ready to insert the distal tap-locking screws. The distal holes containing the guide wires will be utilized for insertion of the initial tap-locking screws. If a 2.7 mm locking screw is selected, there is no need to drill, as the 2 mm guide wire has acted as a drill. If using a 3.5 mm locking screw, re-drill with a 2.8 mm drill in the path of the guide wire. To install the tap-locking screws, a plate tap is selected based upon the diameter of the drill used. There are separate taps for 2.7 mm and 3.5 mm tap-locking screws. The front end of the tap will act as a guide to ensure that the locking screw follows the correct trajectory. After securing the tap to the T-handle, irrigate the drill hole prior to inserting the tap. Slowly tap the plate, 1/4 turn at a time, taking care not to insert the tap deeper than the laser line. The tap cutting flutes must remain engaged into the threads as they cut into the plate, to decrease the risk of cross-threading upon tap removal. There are several important points to keep in mind while using the tap lock system. Clean the tap after tapping each hole. Do not tap a compression slot or re-tap a hole. Plates must be tapped by hand and not under power. Note that the tapped angle must be within a 20-degree angle from the plate for the tap locking screw to fully engage in the plate. If excessive resistance is met while inserting the tap, stop, remove the tap, and discard. Hacumed's taps are for single surgery use only. When tapping the plate, most of the titanium generated remains on the tap. Any remaining titanium should be removed from the surgical site. Insert the gold tap locking screw and fully seat into the plate. If an angle approaching 20 degrees is selected, the head of the screw may be slightly proud. The screw heads were designed not to interfere with soft tissue when inserted at an angle. Do not over-tighten the screw. Insert a second tap locking screw in the medial plate in the same manner. 2 locking screws are recommended distally, but each of the 6 distal holes can be tapped using tap lock technology. Blue locking cortical screws may be inserted into the pre-threaded holes in the shaft at the surgeon's discretion. Standard 2.7 mm and 3.5 mm threaded drill guides for locking screws are available in the system.